Repeatedly advise people, especially pregnant mothers, don't take Tylenol. Sebab ini adalah satu punca anak yang dikandung itu mempunyai ciri-ciri autisma.
Tadi kita tak jumpa lagi satu punca khusus yang menyebabkan autism ni.
Well, what are the parameters of these studies to say so?
Yeah.
And apparently in Sweden, they've already studied to say that, no, it's not. You cannot conclusively say that this thing causes this thing.
And the reason why there are more diagnosis sekarang, sebab sekarang ni kita tahu. Sebelum ni kita tak tahu. I mean,
Hello, selamat datang. Kami di Kita Family ini hari ini merakamkan episod ke-76. So we've got to episode 76 dan hari ini episod kami adalah chit-chat mak-mak neurodivergent. Sebab kita ada banyak untuk chit-chat hari ini. And di Kita Family, kami membincangkan perihal yang berkaitan dengan makna serta kepentingan hidup bermasyarakat. Kami menghargai keunikan serta kepelbagaian sesama kita dan juga meraihkan masyarakat yang berbilang agama, kaum, kepercayaan rupa dan juga keupayaan. Dalam menghargai ini, kami menghargai hidup secara inklusif yang mengambil kira keperluan segenap lapisan masyarakat, terutama mereka yang kurang atau berkelainan upaya. Welcome to episode 76. With me in the studio, on my left is Nori.
Hai, Assalamualaikum.
And on my right is Desri.
hai, selamat sejahtera.
Dan dari Kota Kinabalu, Sabah, Didi.
Assalamualaikum, salam sejahtera.
Okey, mereka semua berbaju merah hari ini. Saya kerana menjadi moderator terpaksa pakai baju warna lain.
Yelah tu. tak dapat memo.
Tak, betul lah tu, tak dapat memo.
Jangan merajuk ya.
Itulah jadi moderator kan. Okay, and Kakak SK tidak dapat bersama kami hari ini, tapi kita ada satu topik yang sangat penting untuk dibincangkan, iaitu satu pengumuman oleh seseorang ketua negara Amerika Syarikat yang telah menjadikan komuniti autism kecoh dengan saranan beliau bahawa ada punca autisma di kalangan masyarakat.
Punca dan ada juga cara nak merawat dengan ubat.
Betul.
Yes.
So I'm just going to read something that came out, third week of September. And he says that he repeatedly advised people, especially pregnant mothers, don't take Tylenol. Sebab ini adalah satu punca anak yang dikandung itu mempunyai ciri-ciri autisma. So that created quite a lot of ripples. Ramai yang telah bersuara berkenaan perkara ini dan Kementerian Kesihatan Malaysia juga telah mengeluarkan satu statement yang dikeluarkan oleh Ketua Pengarah Kementerian Kesihatan yang menyatakan fakta-fakta saintifik tidak menyokong pengumuman yang dibuat oleh Presiden Trump. So kita akan mengupas sedikit apakah pandangan kami sebagai ibu-ibu yang mempunyai anak neurodivergent berkenaan pengumuman ini. So we will start with Nori. Nori, what do you feel, or apakah pandangan anda bila mendengar pengumuman ini dan reaksi?
Okay. I think pada mulanya saya nak sebut mengapa penting untuk kita menyebut tentang perkara ni, penting untuk kita mengulas tentang berita yang telah keluar ni, kerana statement ni datang daripada seorang ketua negara dan bukan ketua negara yang mungkin kurang dikenali. Ini adalah ketua negara iaitu Presiden Amerika Syarikat. President of the United States. Now, ini adalah sebuah negara yang dianggap negara yang berkuasa akan ada yang menyebut bahawa ini masih menjadi negara yang paling berkuasa di dunia mungkin, negara yang besar, negara yang mempunyai banyak pengaruh, negara yang juga mempunyai pengaruh apabila kita menyebut tentang autism.
Betul.
Secara khususnya, tapi kalau kita menyebut tentang perkara-perkara berkaitan dengan kesihatan dan sebagainya. Jadi bila seseorang pada tahap itu memegang satu jawatan yang amat penting dan sangat-sangat berpengaruh, dia akan mendapat perhatian. Tiap-tiap kali Presiden Amerika Syarikat membuat kenyataan rasmi, memang akan menerima pertumpuan. It will be big news, whatever he is talking about.
All over the world.
Yeah. So ini akan menjadi sesuatu yang jadi headline lah, dia berita utama. Okay, so it's not just by the way small little article dan tak ada siapa nak mengendahkan. Kerana apa? Ni akan menyebabkan, ialah seperti mana semua ketua negara, tapi ini adalah ketua negara yang besar dan akan membawa kesan juga kepada negara-negara yang lain kerana kenyataan akan menyebabkan mungkin perubahan terhadap dasar. Perubahan terhadap dasar akan juga berkaitan dengan bermacam-macam langkah akan berlaku. Akan ada tumpuan dan fokus tentang yang berkaitan dengan perbelanjaan, tentang apakah yang menjadi tumpuan fokus priority
dan juga kajian.
Yes, kajian memerlukan kewangan juga. So there's so many things that will happen. So you definitely akan pay attention lah. Kita nak dengar juga apa yang dia akan sebut. Kita juga ambil maklum bahawa perkara yang berkaitan dengan brain science, dan kerana autism ni adalah sesuatu yang berkaitan dengan perkembangan manusia yang melibatkan antaranya minda dan otak kita, fungsi otak, things like that. Memang kita kerap mendengar perkembangan neuroscience sebagai contoh. So in the last katalah 5 to 10 years pun kita memang pernah dengar bermacam-macam perkara. Sebagai contoh, sekarang kita tahu bahawa sains telah membuktikan bahawa kita ada sesuatu that is called neuroplasticity. Itu satu konsep bahawa otak kita memang tetap boleh berkembang, boleh berubah, and sepanjang hayat. And this is not that old, This neuroplasticity is like in the last 2 decades, things like this. So bila dia, bila kita dengar bahawa akan ada satu kenyataan, akan ada pengumuman, kita pun memang nak dengar lah. Tapi masalahnya, apa yang disebutkan oleh Presiden Trump tu mengundang banyak kontroversi.
Betul.
Kerana ada juga kajian yang lain. Ya, Presiden Trump mungkin merujuk pada kajian yang tertentu. Tetapi ada kajian yang lain, sebagai contoh kajian daripada Sweden, yang telah membuktikan bahawa kalaupun ada hubung kait, right? There's a correlation dengan maybe pengambilan sesuatu ubat. Tylenol ni mungkin kita tidak makan di Malaysia. Tylenol is a name brand for acetaminophen, but it's an antipyretic, iaitu sesuatu yang dapat mengurangkan keadaan demam berbandingkan dengan yang lebih kerap digunakan di Malaysia, iaitu paracetamol. Dan paracetamol ni jenama yang paling famous adalah Panadol lah. So kira ini juga disentuh. So it's actually those two things together because they have similar functions. So nak kata Malaysia nak kisah apa, kita tak makan Tylenol pun, but we do take paracetamol.
We do it very readily.
We do take paracetamol. That's our alternative kalau nak berbandingkan dengan US yang akan nak ambil untuk sebarang apa sakit yang mungkin tidak terlalu serius, demam, ada Tylenol untuk beberapa peringkat umur, samalah. So we have a version of that. So of course kita pun interested. Tapi ada macam-macam kajian bahawa balik kepada mungkin ada kaitan, which is the correlation. Tetapi kita tak boleh terus menganggap bahawa kaitan ini adalah bukti bahawa ini adalah penyebab. This is the thing that caused it. This whole thing between correlation and causation. So sebagai contoh, ada seorang telah mengulas bahawa, apakah keadaan seseorang manusia apabila kita mengambil ubat-ubat sebegini? Biasanya sebab kita demam,
Kita kena
sakit,
rawat lah.
headache, sakit kepala sebagai contoh, sakit badan or something like that. And then benda ni of course ubat yang paling lazim digunakan, boleh dibeli hampir di mana-mana. Dah bertahun-tahun dianggap selamat untuk digunakan dengan beberapa, adalah batasan tertentu. Kita tak boleh lah telan ubat ni 10 kali sehari. Jangan mungkin digalakkan ambil dengan makanan minum, things like that. But
Every 4 hours, 6 hours.
Yeah, so there's guidelines. But it's been around for a long time. It's considered safe, right? It's considered safe. So, imagine this situation. I'm only going to take that if I need it lah. Kan? Okay, so let's say keadaan demam. Then demam tu akan ada macam-macam sebab. Mungkin kita demam. Demam mungkin berkaitan dengan sesama. Demam mungkin berkaitan dengan penyakit-penyakit tertentu. Kalau dekat Malaysia ni, orang mungkin kadang-kadang penyakit denggi. That's demam also. So we don't know what it is.
Kadang-kadang dengan sakit gigi.
Yeah. Couldn't you argue that what if it's the penyakit? Katalah ada orang lain pula nak mengatakan bahawa penyakit ini apabila mak jatuh sakit, inilah mungkin membawa kepada satu kesan kepada anak di dalam kandungan. I mean, you could say that, right? I mean, we don't know. We don't. What are the parameters of these studies to say so? And apparently in Sweden, they've already studied to say that, no, it's not. You cannot conclusively say that this thing causes this thing. So one is, which study are you going to look at? Is it, is it true? And even if it's not true, I think the immediate reaction is like, daripada, dari masyarakat, community kita, kan, yang autism, and of course kepada ibu-ibu, it's like, I was trying to make myself feel better. Masa tu saya demam, saya tak tahu. Dan
kalau saya call klinik kesihatan,
bersalah, all this kind
dia
of
kan bagi
thing.
Panadol juga.
Yeah, and then kita rasa bersalah ataupun kita akan marah kepada orang yang suruh kita mengambil ubat sebab dia kata boleh. So many different things happened. On top of that, he then also said, ada juga ubat yang boleh merawat autism yang berkaitan dengan permasalahan pertuturan. So it's like all these statements came out, and then dia bukan sahaja berkongsi tentang kajian tertentu. And then selalunya bila orang akan membuat pengumuman sebegini, kalau datang daripada pengkaji ke, even it's a research company or whatever, always comes with some caution. But somehow President Trump said it very confidently dan mengata bahawa, no, you don't take this anymore. So what if that leads to a situation where a mother is ill, suddenly a pregnant mother develops maybe like a high fever, not just 38 kind of thing,
39,
tapi
40,
betul-betul demam, dan dia risau. Dia kata, I don't want to affect my baby. Dia akan sakit lain pula. I mean, there's so many different things out here. So I think ramai orang, dan bukan saja daripada komuniti kita, masyarakat yang berkaitan dengan perubatan, dengan doktor, dengan pengkaji, dengan orang biasa pun bila dengar berita ni, apa ni?
Semua marah.
Yeah, so it's like, but okay, katalah kita nak menunggu, nak kata kita tak nak lah macam terus ketepikan saja because he's a president. So takkanlah dia nak cakap mengapu, but at the same time, I don't know lah, sometimes I wonder. Anyway, Presiden orang lain.
We all do.
Not my ketua negara, Alhamdulillah. But it's like, it's something that we just have to talk about. And we did a post about it also because, he's very, very important authority lah. He's still influential. That's why it's such a big deal, and we just had to talk about it. Obviously, I care about it lah. That's why I just went on for so long. But it's like, it's a big deal. It matters because lepas ni akan mungkin boleh mempengaruhi keputusan bukan sahaja di peringkat kerajaan, peringkat komuniti perubatan and things like that. This is like personal decisions.
Betul.
It's a big thing. So I think we all need to be informed. You need to know. So like if you got a shock bila dengar berita ni daripada Presiden Trump, dan menganggap bahawa takkan ketua negara nak menipu kot. Takkanlah dia nak buat pengumuman kalau tanpa fakta-fakta dan kajian tertentu. But you must also know there is another side before you make a decision. So I think it's important lah. Kita kena maklum perkara ni. Maybe somebody wants to talk about the medicine that he says is going to fix your child's speech problems.
Okay, so I kena beritahu juga selepas Presiden Trump membuatkan pengumuman ini, ada juga ulasan daripada bekas Presiden Amerika Syarikat iaitu Presiden Barack Obama, mantan presiden, dan beliau menggunakan satu frasa yang memang resonated with me. He said what was said by his successor was violence against the truth. And that was significant.
See?
That was
And
very,
that was and that's a much stronger statement even than like what we have said so far, right?
Absolutely.
Dia memang tidak bersetuju sama sekali.
Dia tidak bersetuju sama sekali kerana
Dengan presiden dia
kajian.
sendiri.
Ya, dengan kajian sebagai bukti kerana banyak kajian telah pun dilakukan di institusi perubatan di Amerika Syarikat dan universiti-universiti dan mereka adalah top researchers yang
No,
membuat
and then he
kajian
brought
ini.
up vaccine also again kan?
Yes, he brought up vaccine
Vaccines again. I said, ini pun dah banyak kajian yang sudah dengan jelas membuktikan, again the same thing, yes, there might be some kind of connection, but it is not clear proof that this causes autism. But, okay, look, we still don't know.
We still don't know.
And that probably means, Desiree, as you said, right? It's because berapa factor, bermacam factor lah yang is involved, right?
So
That's probably why we don't know
Exactly.
what causes autism until today. It's probably not just one thing. Dan kita tak boleh menafikan fakta genetik keturunan.
Betul.
It's partly there also, you know.
So I'm going to ask Desiree this. You know, Desiree, at least when I was growing up, there was this thing that pregnant mothers should refrain from getting German measles. And then they introduced the rubella vaccine,
Yep.
which meant that because if you had German measles when you were pregnant, your chances of having a child that's probably
Some kind of mutation happening to the
impaired in some way, whether it's hearing deficit or blind or some sort of physical disability, was very high. And that was proven. So they created a vaccine. Dengan pengumuman Presiden Trump ni, apakah reaksi Desiree sebagai seorang ibu bila mendengar, kerana Desiree pun telah menjalani proses mengandung itu pada masa yang pengumuman ini tidak dibuat.
Okay, so bila saya mendengar pengumuman ni, part of me was thinking kan, I was thinking it would be sebab there was a big build up to it.
Yeah.
Beberapa bulan sebelum ni, President Trump had given a mandate, I think, to his Secretary of Health to say, let's find a cure and the cause of autism by September and we'll announce it. Kan? So, September datang. Dan so when he announced, I was a bit surprised that pengumumannya adalah apa yang kami anggap sebagai conspiracy theory selama ni. Right? And there's no way to sugarcoat it lah. Basically, the vaccine...
You're using the phrase conspiracy theory. He tried to make it a fact.
Yes. Yeah.
Ouch.
So it to me, at first glance, it came across that way. Right? Tetapi bila saya duduk, saya terfikir, and you know, like you said, that I honestly don't think there is one single cause for autism. Kan? Sebab we cannot deny the truth. Ada anak-anak yang ambil vaksin dan mendapat autism. Tetapi ada juga anak-anak yang tak ambil vaksin are also autistic.
Yes.
And in the
And
kajian,
ramai yang
Yes.
ambil vaksin tak autistik pun.
Betul.
Right. So it's like,
yeah, so it's not one single factor. Ada ibu-ibu yang mengandung ambil Panadol ke, Tylenol ke, anak mereka tak autistik.
Betul.
Kan? Tapi ada yang ambil Panadol, Tylenol dan sebagainya dan anak mereka autistik. So there is no
dan ada tak makan ubat whatever, you know, benda-benda lain berlaku atau tidak berlaku. I mean, there's just too many factors.
There's too
lah,
many
right?
factors. And like what Nori said, we cannot rule out the genetic factor.
Absolutely.
Dalam keluarga kita, cubalah fikir keluarga kita sendirilah, kan?
Yeah.
Ada and we see it, I think almost every week, every month we hear about adults getting diagnosed kerana anak mereka autistic, then they discover, oh, I have some neurodivergent somewhere and I didn't realize until, you know.
I better get a diagnosis
And it's not
also.
It's
Oh,
not
I've
an
lived my
epidemic
life.
either, and the reason why there are more diagnosis sekarang sebab sekarang ni kita tahu. Sebelum ni kita tak tahu. I mean, if you look dekat Malaysia sendiri, saya pernah terbaca artikel in The Star a couple of years ago di mana saya rasa 40% of the people in Tanjung Rambutan sebenarnya mereka autistic. Tetapi pada masa tersebut mereka tak tahu apa tu autism.
Yeah. No, remember how
Yeah.
kita pun pernah discuss, kita bincangkan macam zaman persekolahan kita masing-masing.
Yes.
Kalau kita, macam
Imbas kembali,
kita like,
ada. Ada,
kawan
I
kita dalam kelas tu, budak tu sebenarnya, it's like, see,
yeah.
that's what it was.
Exactly.
Not like slow
Exactly.
or weird or whatever,
And the other thing is, I think there were some statements made that, kalau demam ke sakit, just toughen it up. I mean, okay, kalau demam dia sikit.
Did I come from a guy? Sorry guys, but no, I just want to know. Did it come from somebody who's pregnant, not pregnant?
Nope, that was someone who is a guy.
Oh, there.
Right?
See?
Who doesn't have to go through
Well,
pregnancy.
there you go.
Yeah.
Try being pregnant before you make that suggestion.
Try being pregnant and running a fever. But not medicating a fever when you're pregnant, semasa kita mengandung, sekiranya demamnya terlalu tinggi, it can cause so much more harm
It can
than
cause
the,
fits.
than the Panadol that you take.
Yes.
Or the Tylenol or whatever that you
so
take.
there's all this.
Right,
these
so
things
there's so many things, in this. So I think pada saya, apa-apalah pengumumannya, I think my message to people out there is kita kena bijak membuat keputusan sendiri.
Betul.
Right? Jangan cuba self-medicate. Don't refuse treatment. Right? When in doubt,
because this one person said so.
exactly. When in doubt, consult your GP, your doctor. Consult a proper professional. Jangan self-medicate. Same thing with the folinic acid. And
I think Didi has something to say about that, right? You want to talk about the leucovorin?
Yes,
that's a
I'm going
drug,
to let Didi talk about that. But when it comes to that as well, memang sekiranya ada sesuatu yang boleh membantu anak kita, who doesn't want it, right?
Yeah.
But number one, there isn't enough evidence to support conclusively that memang ini akan membantu.
Yep.
And if you do want to go down that road, please consult a medical practitioner yang boleh advise jenis yang perlu diambil, what's the dosage.
Yes.
Dan janganlah beli online mana-mana
Yeah.
because you need to know whether it's authentic or not.
Betul.
Yeah.
Okay, so Didi, we're going to go to you to get ulasan and your feelings about this pengumuman yang rocked the spectrum world.
Rock the spectrum.
Well, untuk kita yang dah tutup kilang ni, dah tak adalah kan nak fikir lagi nanti macam mana kalau mengandung, nak makan, nak ambil Panadol ke tak bila sakit kepala, demam. Cuma ia menjadi satu kerisauan kepada saya yang berita ini akan mendatangkan kebimbangan lah kepada ibu-ibu yang sedang mengandung, akan mengandung lagi kan, sebab kita ketika mengandung memang kita percaya bahawa paracetamol adalah ubat tahan sakit, ubat demam yang paling selamat lah. Sebab of course bila kita mengandung, doktor akan cakap, ubat ni tak sesuai untuk ibu mengandung, ubat ni sesuai. Dan bila ada anxiety kan, kebimbangan ni, sumber stres, mungkin itu pun boleh menyebabkan mempengaruhi perkembangan anak dalam kandungan. Itu satu.
Yep.
Kedua adalah saya bimbang kalau bila ibu bapa merasakan mereka perlu mengelak mengambil paracetamol, mereka pergi mencari ubat-ubatan alternatif. Mungkin tradisional, mungkin cara-cara lain yang sebenarnya tidak regulated, tidak ada bukti yang ia selamat ataupun boleh mendatangkan mudarat kan. Itu adalah satu yang saya rasa macam agak
itu risiko
jugalah. Risiko kan. Sebab sebenarnya berita punca ni untuk ibu bapa yang memang dah sedia ada anak autistik yang tidak mahu menambah lagi anak, dia bukan satu perkara yang akan membuatkan kita rasa resah sangat sebab anak kita dah memang tentu autistik. Tapi at the same time I think ada juga perasaan di mana I think all of you pun kan mesti terfikir, you will look back, did I take a lot of Panadol when I was
I did.
kan. Mesti terfikir macam So menjadikan
I can't
macam
remember.
kalau kita sendiri pun macam terdetik salah. Mungkin ada orang lain pun akan dengan selambanya pinpoint. Makan ambil Panadol banyak sangat kan. Padahal macam because betul lah macam cakap Nori, it's President of United States kot kan yang buat such statement. So kesan-kesan dari segi stigma, anxiety, which is very very unwelcome lah dalam apa-apa keadaan sekalipun. So that's my thoughts on Tylenol,
that part.
Paracetamol and Panadol.
Okay, so the mom guilt is what you were trying to get out, because kita sebagai ibu bila dapat diagnosis pun mempunyai banyak persoalan. So like what caused it, and ini menjadi satu persoalan tambahan sekarang. Tapi saya nak mengaku saya memang tak suka makan Panadol, and I tahu bila saya tengah pregnant dengan Niraf tu, I tak makan Panadol pun. So I tengah fikir, apakah punca
kalau you tak makan Panadol
kalau I tak makan Panadol. Sebab I lebih suka makan secara natural, or avoid or things like that.
Natural remedies lah.
Cool patch.
Cool patch. I kelapa muda yang memang di United States tak ada kot.
Maybe you need to send them air kelapa muda. No, but Didi, I wanted to hear about your thoughts about the leucovorin thing.
Yes. What do you
Folinic
think?
acid, On the other hand, on the one hand, I know what causes autism, and on the other hand, this is what you take to fix your speech problem.
To treat it.
To treat. There you go.
So Didi, the specific question is this. Katalah you pergi beraya, and berdasarkan apa yang telah diumumkan oleh Presiden Trump, ada seseorang itu datang kepada Didi and say, Didi, dah try tak ubat yang Presiden Trump tu kata boleh mengubat anak Didi? Apakah perasaan
Didi? Should I buy it?
Ouch. Depends. Kalau rasa macam bukan kawan baik, you malah cakap banyak, you just cakap lah, it's not available yet in Malaysia. Tapi kalau mungkin orang yang lebih kan?
Wow, that was very diplomatic. Okay. Teruskan.
Okay, untuk kawan dan kita rasa kita boleh explain dengan lebih mendalam, kita boleh explain lah. Okay, untuk menjadi seorang yang layak untuk mendapat ataupun sesuai untuk mendapatkan rawatan recovery ni, dia ada punca lah. Sebab sebenarnya kan macam Dezri cakap tadi, kita tak jumpa lagi satu punca khusus yang menyebabkan autism ni. Tapi untuk recovery ni, dia ada untuk mereka yang mempunyai masalah menyerap vitamin B, iaitu asid folinik kan. Jadi dia ada kalau mereka ada masalah untuk menyerap folate, laluan folate, folate pathways. So it's very technical and everything. So kalau you ada masalah,
first you have to establish if you have that problem anyway.
Yes, you have macam
because otherwise it's not going to work for you.
Kalau autism pun, kalau you jenis yang impulsif, mungkin ada hyperactivity, then you can take medication to reduce your hyperactivity, but it does not cure autism. So this one, thinking it could be like B complex or acid folidic punya problem, then you can be treated with that. That is the ni lah yang orang US cakap macam tu lah. But that's the thing. You kena carilah doktor yang kata you ada masalah ni, barulah
kenalah mungkin kena buat test juga, right, to see what's going on with your body and its absorption of vitamin B.
Yes. So you cannot like cari online, I want to get this lah online and nak bagi jugalah anak I try. Tak boleh. It has to be option. So you tak tahu side effect dia, and then macam takkanlah you nak cuba sendiri-sendiri. And also kalau kita tengok ulasan-ulasan daripada KKM, ulasan daripada badan-badan besar lain yang ada authority dalam autism ni, mereka juga mengatakan bahawa research tentang recovery ni belum cukup luas. So sample dia dan sebagainya. Jadi mungkin
small sample.
So mungkin kita boleh tunggu dan lihat, keep an open mind, dan keep yourself updated, but not really jadi excited lah, macam nak cuba juga.
So can I say
think that these things
something?
going to fix the problem.
Yeah, so when it comes to supplements kan, sebenarnya jumpa mana-mana doktor pun mereka akan kata
It's not a supplement, okay? It's a drug.
Okay, ubat. Yeah,
Okay.
but still when you take an ubat is for a purpose kan. So you need clinical evidence to support mengapa anda mengambil ubat tersebut. So what is the deficiency to address that? So for example, katakanlah orang for example with bone
what is the
cancer,
illness that you're
for
trying
example,
to fix?
right?
Okay.
And they will tell you to take calcium to strengthen your bones. Tetapi excess of calcium for a bone cancer patient is also dangerous.
It is.
So you need to constantly monitor. So the point is apa-apa benda yang kita ambil sebagai ubat or supplement, dia mesti ada clinical data to support mengapa kita ambil benda tersebut.
Betul.
Jangan sengaja-sengaja go to Shopee and beli and just makan. You know, so there must be a proper clinical reason to take it.
Yeah,
So,
and don't forget that all ubats come with side effects, right?
Yes.
Yeah. So don't self-diagnose. That's
Don't
the
self-medicate.
self-medicate,
Yeah.
self-diagnose. Jangan nak jadi doktor kerana pengumuman oleh Presiden Trump. Itu adalah kesimpulan diskusi kami pada hari
Oh,
ini.
sorry, can I just add one last thing? I want to say one positive thing about this whole thing.
Okay.
Which is the fact that beliau adalah Presiden Amerika Syarikat. Dia telah meletakkan autism as a top priority sekarang sebenarnya. So if you want to look at it from a hopeful perspective, it made all the doctors, professors semua dah bangkit and say, no, look at all this research, and it's going to, I think, make the researchers work a little bit harder now maybe.
Yep. People going to get a bit more
and
educated about autism.
and the fact that it's been brought up by such an influential person, there should be more funding to fund research related to autism. That's my hope.
Okay.
Okay.
Take a break.
We will take a break, but just before we conclude that, I wanted to just express the fact that if any mum feels tertekan oleh news ini, please baca pengumuman daripada KKM. Kita telah, seperti Nori cakap, kita telah membuat post di social media yang menunjukkan apa yang dikatakan oleh Ketua Pengarah KKM mengenai isu ini, dan sila baca dan sila dapatkan nasihat daripada doktor anda dan doktor pakar di klinik kesihatan atau di mana-mana hospital yang anda menjalani follow up. Okay, so with that, can I just take a short break and we shall see you after the break. Hello, selamat kembali ke episod ke-76 Kita Family Podcast. Before the break, this chit-chat Mak-Mak Neurodivergent was discussing the very controversial announcement by President Trump. Now we're going to move to some questions that we had during KL Podfest last week when we did the live show that we could not answer.
Tak sempat.
Tak sempat. So hari ini kita nak menjawab soalan-soalan yang dikemukakan oleh penonton-penonton. So keep questions coming, yeah? See, we do take note. Okay, first question. And I will start with Didi. Ya. Didi, is it okay as a parent to letak goals kepada anak ASD? Contohnya, aim nak masukkan anak ke aliran perdana normal bila anak itu mencapai 7 tahun.
Was there any other example? That was the one.
That was the only
That was
example.
the news.
Of course perlu ada goal, sebab bila ada goal kita ada steps kan, apa yang perlu kita penuhi, kriteria yang perlu dicapai sebelum anak kita boleh masuk ke mainstream pada umur 7 tahun lah. Dan bila kita ada checklist tu, kita boleh tahulah di mana tak perkembangan anak kita. Cumanya kita perlu realistik juga. Jika anak kita tidak capai tahap readiness pada umur 6 tahun, nampak kan tidak bersedia, maka kita perlulah memikirkan alternatif lain lah. Mungkin pergi ke center ataupun PPKI, sebab bila anak kita ada autistik kan, kita tak boleh jangka dia punya perkembangan tu. dia punya development tu boleh sampai ke tahap yang sama dengan rakan-rakan sebaya atau tidak, walaupun dengan terapi yang intensif, dengan pelbagai enrichment activities. Memang kita mengharapkan yang terbaik lah. Of course, bila kita doa, bila kita usaha tu, kita nak yang terbaik. Kita tak adalah macam kata bila kita usaha tu macam tak apalah, hantar 3 kali seminggu pun kalau tak ada improvement pun saya okay. Tak kan? Mesti kita mengharapkan ada improvement, ada perubahan. Tapi itulah, it's always being rational, being realistic. Kita selalu perlu pantau lah pencapaian anak kita. Sebab tu bila kalau masuk EIP selalunya at least every 6 months, if not every month, akan tengok balik IEP kan, Individualized Educational Plan. Mana goal yang dah dicapai, mana yang belum, mana yang perlu tambah lagi. Jadi sebagai ibu bapa ni kita perlu faham lah kalau untuk qualify, layak untuk dan sesuai untuk masuk ke darjah tahun 1 di sekolah kebangsaan, primary school, apakah kriteria, apakah kebolehan, kemampuan yang anak kita perlu capai. Macam contoh, of course toilet train kena ready, kena settle. Maksudnya bukan sekadar boleh pergi ke toilet tapi independent lah. Ada independent dari segi mendengar arahan, boleh follow the transition of the class. So banyak yang kita perlu tengok, lebih daripada kalau kita ada anak tipikal yang selalunya lebih lah kan, masuk umur 4 tahun masuk tadika, kemudian habis 6 tahun okeylah masuk sekolah kebangsaan. Jadi bila ada anak autistik ni, you perlu peka dengan setiap yang diperlukan oleh pihak sekolah dan juga apa yang anak you boleh buat. Because macam saya kan, pengalaman kami sendiri dengan 2 anak autistik, mereka kedua-duanya masuk ke mainstream tahun 1. Tapi hanya berada di mainstream education. Macam untuk adik lebih kurang 2 tahun dan untuk kakak 4 tahun, dan kemudian kami rasakan dia tidak sesuai lagi. Jadi kita sendiri tidak perlu takutlah untuk mengambil action kalau rasa macam dah tak sesuai, perlu ada perubahan. Sebab yang penting anak kita tu kan berada di tempat yang dia boleh belajar. Jangan jadikan sekolah tu daycare sahaja.
Okay. So perkembangan anak itu adalah penting. That's your that's your takeaway to say, okay, it's okay to set goals, tetapi tengok juga perkembangan dia. Okay.
Yes.
So Nuri, what would you feel are realistic goals or goals that a parent should plan? Sebab sekarang kat klinik kesihatan pun ada checklist kan. Kadang-kadang diagnosis datang awal, 2 tahun lebih, 3 tahun. So planning up to 7 years, what do you think realistic goals are?
Ini menarik juga kalau soalan ni bagi saya, sebab kalau tanya saya mungkin 5 tahun dulu, mungkin jawapan saya berbeza kan. So when you talk about goals, we're talking about matlamat, sasaran, and which is connected to harapan, untuk anak kita lah, dari segi pencapaian, dari segi kebolehan, kemahiran yang ada pada dia. And it is right, of course we want the best, and I think the hope should still be there. Let's be clear about that, right? Best and the hope. But kita pun tahu sebagai, dah jadi parent, ibu yang lebih berpengalaman, kita perlu agak fleksibel, right? Kita perlu bukan saja nak memastikan bahawa kita sendiri semakin peka tentang keadaan dan perkembangan anak kita, but it's like also that continuing education lah for ourselves. Kita nak mengajar anak kita atau mengharapkan bahawa anak kita dapat belajar, tapi kita sendiri juga kena belajar kan. So yang Nuri dah belajar ialah dalam sebagai ibu, dalam perjalanan sendiri, is satu that thing about continuous learning, tapi relearning dan unlearning pun ada. Sebab kadang-kadang kita kena, matlamat tu perlu diubah sedikit. Sebagai contoh, kadang-kadang yang perlu berubah is not the goal but the jangka masa, timing, right? So maybe boleh masuk ke aliran perdana, sama ada sekolah kebangsaan, sama ada sekolah swasta ke apa ke, tapi sekolah di mana kanak-kanak lazim pergi. So it's a big regular school, typical school, or disebut sebagai normal daripada penonton yang menunjukkan soalan ni kepada kita. But yeah, so there has to maybe be some flexibility with that kind of adjustment. But I think when you talk about realistic, and I sit back and I think about it now, I think we, not just me, but we as parents, so mama and papa, but also like the family, we probably would have adjusted the priority of our goals about this matlamat and sasaran. And I think that we really, and kita dah pernah menyebut, tentang perkara ni di episod-episod sebelum ni, kita nak memastikan, kesihatan dan kebahagiaan anak kita lah actually. Because kalau anak kita mungkin tidak tenteram, anak kita bukan anak yang, kira calm and happy and regulated and all those things that we want. Ada macam-macam phrase lah that we use, when we talk about a neurodivergent child. If you don't have that, it's really hard to learn just as a human being. So even when you're not a neurodivergent person, imagine when you're experiencing a lot of stress, or you get to the point where, maybe you become unwell in some respect. Katalah macam the gut health and things like that. I mean, kalau kita nak, buka cerita dengan benda-benda yang berhubung kait dengan autism, one of the big things yang the research has shown, many research is, maybe connection to gut health, which can affect a few different things. Tapi itu pun tak kata akan merawat kalau dah settle apa gut health kita pun. But anyway, what I'm saying is, really the priority and the realistic goal is, we would probably change it, tengok kepada kesihatan emosi dan social, so the social emotional health, and is my kid, still happy, does my kid still feels like they belong, to make sure my kid is not stressed, to, if I know more, I would be on the lookout. Is there something that could end up causing him trauma? Because I think he did experience trauma, at least my own son. So realistic goals tu lain sikit lah. So maybe I will not, and it's basically kalau your anak dah anak yang mempunyai kelainan tertentu, kita dah tahu anak kita ada tahap tertentu atau di sebahagiannya mempunyai permasalahan yang, the OKU related. It's a disability thing. You don't put the same goals as you would put for a typical child. You can, but there has to be some adjustment. Right? Not saying, langsung tak boleh ada matlamat yang sama seperti anak yang lain. Itu pun tak masuk akal. Sebab kita pun tahu anak-anak yang neurodivergent, autistic ke ADHD ke dyslexia ke whatever, sampai juga ke universiti, dapat juga bekerja, dapat juga berkahwin. So bukan nak kata, matlamat ni semua tidak boleh diguna pakai. But I'm just saying that be a bit flexible and then really, really think about it. And then, back to Didi's point, and Anik pun menyebut, kita tengoklah kepada anak kita sendiri.
Give them time to grow.
Yeah, and perkembangan dia. So that is this can lead us to the next question that we need to answer. It is a person-centered approach. It's that individual. Anak I tak sama dengan anak ni. Tak sama dengan anak Didi. Tak sama dengan Didi's girls.
Tak sama dengan
girls. Tengoklah kepada anak di depan kita.
Anak Didi pun tak sama. Dua-dua pun berbeza.
Anak Didi, 2 girls pun tak sama juga.
Anak kakak pun lain.
Yes. Totally
lain, right? So we go into that. So
yeah.
I want to go to Desiree. Desiree, this setting goals, dia memang jadi matlamat Asian parent tau.
Yes.
Okay. So I'm sure
Asian parents.
Asian parents. Very goal oriented.
We are very goal oriented. If not, we are reminded that we should be goal oriented.
Yes.
Tiger mom.
Because people around us selalu cakap, kenapa anak you sampai sekarang tak boleh buat macam ni? Sepatutnya dah boleh. What are you doing? And they offer advice even if it's not solicited.
Sorry. The response to that was just bunyi. Tak tahu apa nak sebut. Bunyi saja.
Dengar soalan pun dah sakit hati. I can feel the piercing in my heart. No, anyway.
Okay.
Tapi sebenarnya goals ni pada saya bagus. It's good. You
Yeah,
need to have
Didi said
goals.
also. Good to have goals.
And I agree with Didi, Nori and all that. Memang penting. And also berdasarkan soalan ni, why not to have the goal of your child masuk aliran perdana bila umur 7 tahun, parents mana yang tak nak? If you ask me, 8-9 years ago, memang itulah dalam
That's your
fikiran
goal
saya.
too, right?
It's an
My goal too was I like him to go to school with everybody else.
I want him to have as normal a life as possible.
Yep.
Tetapi in setting those goals, I think very important. We said it, kena realistic and ask ourselves dua benda. First thing, goal tu sebenarnya realistic untuk anak kita, or is it something that we want for our child? Okay. Is it our
correct.
ego,
Betul.
our maruah, our apa ni lah,
everything
family,
Air
whatever
muka.
lah to please this person or that person. That's one thing.
Or is it bragging rights?
Bragging rights, yes. Who doesn't want bragging rights? Semua orang nak kan? But we have to be realistic. And
Betul.
secondly, is it attainable and achievable? So janganlah set goals yang memang susah, tak boleh tercapai. So for example, for a non-verbal child, janganlah set, he must speak in full sentences in the next 6 months. Dia start membebel pun is a celebration. So, in setting goals, kita kena celebrate setiap tahap. Walaupun tak sampai ke tahap yang kita nak, tetapi sekiranya ada sedikit perubahan pun,
I like that. The
celebrate
celebrating.
it.
And
Yeah.
and it also connects. Satu celebrate. Then other thing is don't you set lah yourself up
For
sampai you
failure.
kecewa, kecundang, sedih, merana. Don't.
Yep.
Sampai you kena pergi jumpa therapist, counselor. Okay.
Kalau perlu pergi
Kalau perlu pergi,
Yes,
tapi janganlah letak matlamat yang sukar untuk
Yes,
dicapai.
Yeah.
Itu
But Didi
adalah
was going to say something.
Mustahil.
Sorry, Didi?
Ya,
I think kan kita sebab tu walaupun anak baru dapat diagnosis ataupun masih dalam fasa awal kan berada dalam komuniti autism ni, saya selalu ulang, it's very important to be in the community and to hear stories, dengar cerita pengalaman daripada mereka menjadi anak yang telah dewasa supaya kita boleh belajar sebenarnya ada banyak cara untuk anak kita boleh thriving, boleh sukses. Dia bukan satu jalan je.
Multiple pathways.
Yeah.
actually I need to share this story. Actually, just today, I saw a post by another mum of a neurodivergent child yang menyatakan bahawa dia telah book holiday before the end of school term sebab dia anggapkan anak dia takkan menerima apa-apa anugerah. Kerana selama ni dah 4 tahun di sekolah, tak pernah menang apa-apa anugerah, dan hari anugerah itu adalah satu hari yang memang not for her child lah. Tapi tahun ni bila dia book holiday tu dah pergi, baru tahu anak tu memang dipilih untuk menerima anugerah. So her goal was not that. Her goal was, memang anak saya takkan dapat lah. I pergi je holiday. It doesn't matter kalau dia miss 1 week of school. Sebab tu minggu hari anugerah. So bila saya membaca tu, saya memang tersenyum because dengan anak-anak neurodivergent, they surprise us all the time. When you least expect it. So that was a story where ibu dia tidak menetapkan apa-apa goal untuk anak dia. Tetapi anak dia yang telah
mencapai something so wonderful in a way.
So that was a very positive thing. So sometimes when you don't set goals, there are surprises in store.
Okay.
So that
Absolutely.
that was the story. And we'll move on to the next question. Whether SPELL or ABA. Now, these are two very different concepts. I will leave you to give an illustration, Nori, as to what is SPELL and what is ABA. And what should a parent of some child that's just been diagnosed opt for? Okay, it's a big discussion. So everybody tolong masuk.
Yes, everybody please chime in. Okay, let me try to start. Okay. First of all, one clearly describes itself as a framework, SPELL. SPELL ini adalah satu, is it rangka kerja? Framework. So maknanya dia sebagai satu macam panduan. And it's like a rangka. Maknanya ini boleh jadi sesuatu rujukan. SPELL clearly says that it's a framework. Okay. Spell ini pun lain asal usulnya. Spell, kalau tak silap saya, spell dari UK. Banyak digunakan oleh National Autism Society of the UK, in the UK. Spell juga telah berusaha untuk memastikan dalam membina framework ni ada penglibatan individu autistik juga. Okay? Because basically Spell has a very person-centered approach. Spell juga ada falsafahnya yang tertentu. So benda-benda ni adalah lain kalau kita nak menyebut tentang ABA. Bukan nak kata ABA tak ada framework. ABA is a framework also,
On its own.
but it's more known as a approach and a methodology in terms of a therapeutic sort of program.
For neurodivergence. Yes.
For neurodivergence, and it is very much connected to behavior and it's built around that. Ini pun ada a lot of the pluses and the minuses lah. So maybe because I want all of us to jump in and talk about it a lot, I would like to say that I think a framework is always very good to have. And saya sendiri pernah menjalani kursus Spell. Dan I think it would have been good maybe to do it a bit earlier. We ended up doing it later. Desiree and I did it actually after Didi did it.
Yeah.
And we were talking about how you all, kita kan dah memang macam-macam kursus, nak pergi ke kursus ni, you know, because it starts off again with like, what is autism? So we're like, dah lepas 8 tahun pun what is autism? So it was like, you know, then Didi was like, no, you should go. And so she can tell you why she strongly felt, and she asked us to, you know,
And I have to thank Nori. I almost didn't go, and she said,
no, we're going
we're
together.
going together.
Yes, yeah.
I'm like, okay, let's
No, going together. No, I did it. Kari did it, and we're very glad to have done it. And we have very good spell trainers here in Malaysia. Sungguh pun tak ramai because I think it's a little bit newer for us. But it was, you know, really nice to see. It's like kita nak memastikan bahawa kita memikirkan individu itu. That's one of the big things about spell, right? There is it's a very person-centered approach. So it really depends on your autistic person that is under your care, that is your loved one, that is your child. So you have to always think about that first. Just as like we would think about, you know, I mean, guys, all of you mungkin yang dengar ni datang daripada keluarga besar, you know, your adik-beradik all not the same. But kita pun dah biasa nak tahu PL dia macam ni lah, atau dia macam tu. Okay, kita boleh, you know, harapkan dia untuk ni, itu, whatever. Jangan kita ingat semata-mata sebab dah kena, you know, or kena pula sebab dah dapat diagnosis autism tu, macam semua sama, every autistic person, dan kita ikut cara ni. So I think Spell is much better at doing that compared to like, you know, the ABA approach, which is like the whole guidelines and methods is like, it's kind of a recommendation pretty much for all autistic people. Tak kisahlah which level, you know, things like that and age. Yeah, so that's one of the criticisms. But okay, to be fair, let's come back a bit. And what I would say is, I think you should explore, maybe go and find out for yourself about ABA. Because ABA has also changed.
Yes.
Ada sejarah ya. Dan antara yang menjadi kritikan, like Anit sebut perkataan rigid ke, maknanya dia terlalu apa,
ketat
dia
dengan
dia tak ada flexibility. Dia memang you know, macam cara dia tak dapat diubah and things like that. This is all related to the sejarah jugalah. But it is one of the methods of therapy
and
that
training
has you know, that wants to address how well, basically actually it's talking about addressing the behaviours, because sometimes itulah yang menjadi kerisauan apabila kita mempunyai anak autistik, that dia ni terlalu jauh berbeza ataupun dia akan, you know, tingkah lakunya pada tahap yang tidak selamat, langsung tidak sesuai, merusingkan, you know, it's things like that. So it's not just maybe, that's kind of cute or quirky, atau dia menunjukkan perbezaan dia sedikit, but it's something yang membuat kita risau bahawa mungkin dia tidak dapat, you know, belajar, berkembang, fit in, belong, you know. So there's different things. But I would think, if you logically lah, if you're talking about, you know, some kind of education, tarbiyah or whatever, look at find the philosophy first. Get like a frame of reference, because when you do something like Spell, then you can take that, and then whenever there is like therapy option, there's a new idea that comes up, or somebody says, oh, try this method for improving executive function skills or whatever, then you take your framework and you can look at it and you go, adakah ini sesuatu yang mengambil kira keperluan individu anak saya? Adakah benda ini sesuatu yang sesuai bagi keadaan dia? And then you look at things also like empathy and respect, and you look at things like are these things connected to like links in collaboration and stuff like that, which are also aspects of spell. But at the same time, maybe also encourages this. They also want connection and collaboration and stuff like that. So memang ada. So maybe one of the rest of you can talk about, some of the things where it's similar. But essentially, one is more a framework. Yes, the other one has a framework. And the framework of ABA is to say that there's structure in place. There is a very clear approach. We do believe that, behavior can manage. So it's got its own thing. It is definitely two different things. But if you are willing to do both, I would do spell first before I do ABA. Because then I want to make sure that my ABA therapy and therapist has changed with the times and is not going to be the old type of ABA, which, if you have not heard, was not just criticized in terms of maybe being outdated or not so effective, but individu-individu autistik sendiri, ramai yang telah kata bila they went through it, they were traumatized. Not to say that it's not positive at all. I'm not telling you don't go and do it. Okay, it's not. I'm just saying that if you have the choice, or this is what you want to do, or you want to investigate both, do the framework first. And then I think if you are thinking about time, resources, money, all this kind of thing, tak tahu yang mana, whatever dulu, again, I would also still say look at the framework first lah, because it gives you gives you a very, very good understanding. And it wants you to really understand what is autism. ABA still doesn't do that, I think. I don't think it spends a lot of time doing that. They already ABA is like, let's
Fix the
get
problem.
to addressing it. Yeah. Fixing the problem tu pun ada problem sikit lah. Because some people say, fix what? Does everything need to be fixed? So
let's take that to Didi.
Yes.
Didi.
Somebody else talk.
For ABA and spell, for why was it you were so inspired by spell? So start with that first, Didi, and then go on to ABA and fitting the box.
Okay, firstly, of course, I was introduced or encouraged to join spell training by an autistic person herself, Beatrice Leong. She was adamantly say, Didi, you need to attend this. So I attended, and bila I dah attend, I'm like, this one, semua orang pun perlu attend. So the three of us, myself, Nori and Desiree, we are licensed spell user. So we can apply spell. And both time I attended, and also masa Nori and Desiree attended the course, I attended again, just menyebut there. I did see a number of ABA therapists attending the workshop juga. So it shows that ABA therapists dia tak adalah macam no ABA is the best, don't want to learn about anything else. And then we can see the approaches kan. Kalau you see ABA centers, you look at their website ke apa, they also include things on sensory, and also their nampak more neuroaffirming jugalah. So that's why
adjust sikit.
Dah adjust. I agree dengan Nori. Semua parents perlu belajar tentang spell, and then only you can identify, center ni neuroaffirming or not. Neuroaffirming maksudnya dia respect lah, person-centered.
Respectful of the autism.
Yes. So itu pun sangat penting lah. Sebab spell ni dia bukannya ada semua method. Dia bukan macam, if you this is the method to use. Spell doesn't have that. But once you know the structure, the framework, then bila ada apa-apa method pun, you boleh recognize, this method sesuai ke untuk you implement kepada mereka yang autistik. So itu yang penting lah. But at the same time, I cannot deny, because kan even you pergi OT ke, speech therapist ke, they would still apply some of ABA methods. Sebab
Absolutely.
banyak kan, you cannot macam
Run away.
sekarang pun kan tak boleh run away from a lot of ABA methods,
Betul.
macam first and then, visual schedule, those are very helpful because kita nampak kan dia memang betul-betul mengurangkan anxiety anak-anak kita bila kita gunakan
structure. Autistic people
the
do
structure,
need
yes.
and thrive on structure. That is a very ABA important pillar.
And with ABA also, they maintain and keep data of how long it takes for you to
Yes, they have a way to measure.
document
They have
and
a way to
measure
Yes.
how long it takes for you to master a skill and when the next step can be introduced. Right?
For
Cumanya
example,
sekarang,
that's one of the measures. It depends, right?
Yes.
What are you measuring?
What are you measuring? We just
but they are
giving-
always measuring. They are measuring many things. So
They're measuring and they come up with reports. So it becomes very much a data-driven sort of method.
Evidence-based in a way.
So it's goals driven, like we were talking about. I did mention tadi
tadi
kan,
kita sebut
Asian
matlamat,
parents
yes.
kan kita suka measure the outcome. So
That's part of the
ABA
appeal lah.
has that appeal. Sebab tu saya rasa masih popular jugalah di Malaysia because and is usually sold as the gold standard, evidence based. So memang the appeal is there. Bukan nak kata dia tak baik langsung. There are many benefits to it as well. But I'm going to let Didi finish before I share my thoughts on ABA and spell.
Okay, so sebab sejarahnya ABA is all about nak mengurangkan sifat dan ciri-ciri autistik di dalam mereka yang autistik. Dia nak kurangkan supaya in the end you jadi normal. You nampak normal, you boleh kawal diri you. Tapi bila kita belajar spell, so bila kita dah belajar tentang spell ni, kita tahulah being autistic is an identity itself. So tak perlu semua benda like you nak perlu pretend, perlu masking. Kita perlu lebih sebagai caregiver sepatutnya lebih terbuka, dan sebagai guru pun, sebagai terapis pun perlu terbuka dan menerima kelainan mereka. So memberi skill, kemahiran dan mengubah sifat seseorang itu adalah satu yang berbeza. So that's why we need to be very careful and be mindful lah bila pergi ke therapy center, either ABA ke OT ke apa. Because like I said lah, OT pun mereka menggunakan some of ABA methods juga. Kalau you pergi EIP pun masih ada juga. Jadi bila kita belajar tu dan kita ada framework, kita sendiri boleh fikir lah kan, macam ini kalau anak kita steaming pun asyik kena marah, ataupun setiap kali kita ambil anak kita daripada terapi, tadi dia ni steaming sangat lah, alamak, then we know lah kan. So
but it's like basically it's because why is this question also coming up? Sebab tak semua ABA sama.
Betul. Dan tak semua kursus yang dibuat seragam ataupun uniform.
But spell in terms of framework is very clear. Actually, Didi, when you jump, Desiree, when you jump in, maybe you can spell out what's SPEL. Also, just be a bit clear, and also applied behavior analysis. Maybe do a little bit of that. Sorry, I should have done that.
So what are the acronyms? What is SPEL and what is ABA?
Okay, so SPEL it stands for structured, positive meaning the positive reinforcements, which is one of the commonalities it has with ABA. So ABA also does positive reinforcement, right?
It does structure too.
Empathetic.
Yes.
Right?
Okay.
So seeing it from the autistic's perspective, bukan
Which is not an
perspektif kita
ABA
saja.
thing.
That's
Before
not
lah,
an ABA thing.
dulu. It's not a thing.
Low arousal. So di sini kita acknowledge the sensory processing challenges, kan?
Yes.
So low arousal. And the other one is links. Links is di mana kita selalu bincang dalam KFM tentang the village and the team,
Connection, collaborating,
the wearing many hats, kan? So links meaning semua orang is included when we are making a plan or a decision or a choice, including the autistic person is always included in the decision making process. So that's the links part. So ABA stands for Applied Behavioral Analysis. That's what the acronym is for. And some of the elements of ABA that I actually like is the reinforcement and prompting. So reinforcement is good ketika kita ingin mengajar academic skills. Guru biasa pun gunakan
Reinforcement. Yeah.
right? But we want to use positive reinforcement, right?
Okay.
Not so much punishment lah kan. Even dalam kelas biasa pun we want to move away from that. Let's not do the whole punishment thing. Let's be more positive. Right? And prompting. So prompting is something that I think is very important. So prompting is when we give them the positive reinforcement to do a task. So for example, Hans menulis memang sangat mencabar untuk dia. Kan? So because of the dysgraphia, fine motor skills, nak pegang pensel, nak menulis. So kadang-kadang dia pun macam tak nak lah menulis. So he has gone from prompting in a form of scaffolding for him. Cikgu pegang tangan dia, to teacher just pegang dan menulis, and then just pegang, and then now teacher have to just tap saja. Tap dan dia akan tulis. So that is prompting. You are not doing it for them, you are prompting them. So this is actually a skill that
ada pendorong lah.
Ada pendorong. So this actually comes from ABA, right? Which I didn't know earlier until I read more about ABA. Yeah. Sebenarnya my preference
you
has
didn't choose
always,
ABA. That's why you had to read up.
Exactly.
Yeah, so maybe you want to share.
Yeah. So ABA wasn't
your choice.
Wasn't my choice. So
kenapa bukan jadi pilihan Desri?
Sebab pada masa tersebut, bila Hans berumur 2 tahun, he was very young, right, when he was diagnosed, and this was 2017. Masa tu sebenarnya banyak ajaran sesat actually ABA that I came across. Kan? So from people who told me, no, you must do verbal behavior with your son, make him speak, and I'm like, like,
oh gosh.
And things like ABA therapists yang who told me that, oh, we don't believe in AAC. Tetapi sekarang, so like going back to what Nori said, ABA pun telah evolve as a practice, and the practitioners, they are evolving. So I really want to acknowledge that. Right, because I've
but
had
check.
Yeah.
You still have to check.
You still have to check.
Yeah,
right.
Where some old school ones, no.
So baru-baru ni saya ada dengar seorang ABA therapist talking about the use of AAC in their center for ABA, for communication, and they are also changing their language a little bit when they talk
and
about
accepting multidisciplinary approaches like input of OT, input of SLP. At one point in time, they're like, no, perfect 35 hours.
yes,
so,
don't do anything but ABA.
Yeah, but I think it's wonderful when people in our community, especially those who are like the educators, come therapists and all that, right? When they learn more, they also evolve, they also change. This is good for everybody.
Correct. So I want to just go back to the question, because the question also says that her child is 2 years old and doing speech therapy and OT.
So this is really early now.
So I want to say that, and she doesn't know how, he or she doesn't know how to gauge the progress. So I want to say, Mama or Papa, take a breath. Anak, saya rasa mungkin baru diagnose. I can understand the rasa cemas, the wanting to do everything, the wanting to be trained immediately and learn everything and anything under the sun. I was there before. So my pro tip is, if you had to choose, buatlah spell dulu. Tetapi don't completely dismiss ABA and the elements that maybe are suitable for your child. Sebab setiap kanak-kanak,
no, macam Didi kata lah, go and find a spell-trained ABA therapist with good experience and all the elements which are like neuroaffirming, respectful, empathetic, And you may nowadays you could. Dah zaman kita maybe not so integrated. Tak ada lah.
Correct. And if this mom is goal-oriented, tanya, will you work with me on the goals that I would like for my child? Ada je yang akan buat.
Yes, but also, if you have a lot of experience, please talk to me about some of these goals if you think that they might need to be adjusted.
So jadi, simpulannya adalah kita tidak boleh sangat rigid apabila menetapkan matlamat ini. Kita perlu dapatkan input daripada terapi-terapi lain yang ahli terapi itu mungkin boleh memberi cadangan selepas bekerjasama dengan anak.
No, and then dua-dua approach ni, dua-dua kaedah dan yang kita sebut ni lah, dari segi elemen terapinya dan kepentingan terhadap especially ibu bapa whatever, ada peranan dia lah. Right?
Yes.
Do your homework, do your own research, see what works for you. But sounds like there's a consensus, right? Do the framework first.
Yeah, do the framework first and take the
Yeah.
lead from your child. So I think if anything pun take the lead from your child sebab semua
Because if
anak
your
kita
child is
berbeza.
already doing SLP, OT, whatever, and they're tired,
Maybe dah
hang
cukup
on
for now.
first. Yeah, just spend your time and energy
And
not totally on your parent training yet. Maybe just spend more time cuddling your kid and giving them some love, and then do the training in 6 months. And something like.
Yep.
Hey, we have one more question, right?
No, we do, and I just want to wrap up this topic by saying that both SPELL and ABA have one thing in common, which I see, although I'm not trained in SPELL, is neuroplasticity. Both acknowledge that the brain can evolve, and it's just the right intervention and the right motivation and the right skills that will allow the children to grow.
Yep.
So give them the chance to grow. Kalau sebagai seorang parent, there is a different technique than the way you have been brought up, or anda telah belajar, tolong cuba teknik yang lain. Itu mungkin teknik yang sesuai untuk anak anda.
Bergantung pada individu lah. Anak kita yang tipikal, yang biasa-biasa ni pun tak semua belajar cara yang sama. So again, look at your kid.
Look at your kid.
Yep.
So the last question is, which I think we can do very quickly because I think we've discussed most of it, is how to always stay rational and wise in choosing therapy.
Oh, don't be too stressed out when you make these choices. Don't make your choices in a rush. Jangan rasa tertekan. Jangan rasa bahawa keputusan itu pun muktamad dan tidak dapat ditukar, So I think it's okay to take your time with it because sekarang kita pun dah tahu mana-mana keadaan neurodivergence ni pun adalah sesuatu yang sebahagian daripada individu itu dan ini adalah sepanjang hayat. So, and I think it's okay. I know lah people talk about golden window, whatever. No, as you said, I need neuroplasticity. Ada peluang. Sama ada kita buat keputusan tentang terapi whatever yang tertentu dalam masa 2 minggu atau 2 bulan ke 2 tahun. It's okay. So that rationale is like always pause, and then pause is another. We talked about that in one of the early episodes. Pause is a very good tool to keep you with that rationale and how to choose. And then also immediately for me again is the thing that Didi said, connect to community. So talk to orang lain juga yang berpengalaman and all. So that was really good question actually. Yep.
Okay, Didi, what would your skill be on how to stay rational and wise? And maybe you could take it in the context of the cost of therapy as well. Sorry to throw that at you, but I think that's important.
Because I wasn't at the pod first. Okay. Cool.
Yeah. Oh, yeah. Please check out our episode from KL Podfest. We talk about money there. And then, of course, like just what I say in the KL Podfest, you cannot plan on spending the money that you don't have. Janganlah sampai buat loan ke apa, because kalau you buat loan, nanti you still kena bayar bertambah kan you punya commitments setiap bulan. And terapi tu bukannya you boleh 2 bulan terapi lepas tu dah tak perlu dah. We have to think of therapy as a long term commitment. So bila long term, you have to think about your you boleh afford ke tak, how much you can afford monthly, and then if you need to adjust your lifestyle so that you can afford the kind of therapy that you want for your kids. You nak downgrade your kereta ke, you nak pindah rumah, a smaller house ke. So what kind of adjustment that you want to do, but always make sure that you are on the same page with your spouse, with your husband. Please jangan sampai gaduh-gaduh.
Good advice.
Jangan sampai jangan sampai you diam-diam guna kan, kalau mungkin ada yang ada joint account ataupun the wife ada supplementary credit card from the husband, using it without not kata permission,
prior
but
discussion.
Consulting with your partner lah, and the parent, the other parent kan. Especially kalau the jumlah tu besar.
Yeah. And memang kita pun pernah discuss yang kan tahap all these grieving phases, denial ke apa tak sama. Mak dengan ayah sendiri pun tak sama. But please jangan jadikan satu menampakkan tension lah kan, nak gaduh pasal terapi. And also lagi satu, logistically dari segi jarak, location, you mampu tak? Because I learn from my experience. Saya pernah nak sangat hantar dekat satu center yang jauh. Dia bukan jauh, tapi because of the timing kan, menjadikan ya masa pergi
Traffic.
30 minit sampai, tapi bila nak balik 2 jam baru sampai rumah. So think about the logistic as well, and then the availability lah. Center tu ada tak waktu ada tak dia available pada waktu yang you boleh hantar anak you. Contoh kalau you hanya boleh hantar pada weekend, center mana yang buka pada weekend. Dan kalau dah buat keputusan tu, look also at the commitment required by the therapist lah. Sebab sekarang ni memang a lot of therapist dia memang memerlukan ibu bapa untuk
Betul.
memberi komitmen kan untuk membuat homework dengan anak. So
it's not so simple as just what is the rate of effectiveness of this one versus this one, popularity of this one versus okay, I want this. So many factors, right? That can help keep you rational.
And wise. And Desiree.
Okay, so 4 key things very quickly. First is take the lead from your child. And if you want to know if how to choose rationally and wisely, take the lead from your child. If the child is not enjoying it, is resisting it, that's a red flag lah. Kan? Next is speak to fellow parents untuk mendapat pendapat mereka, to keep you, build your own village. I think this came out as well at the KL Podfest. Someone mentioned about having a village, so build your own, join one.
We keep talking about it also.
We keep talking, yeah, exactly. And good relationships dengan practitioners. So always have good open communication with the practitioners, sebab mereka boleh memberi nasihat. Okay, maybe benda ni sesuai untuk anak anda, or maybe you need more or you need less.
Yeah, or the method might be great, but you meet the therapist and you're like, you know, kalau tak ngam tu, do you want to force it? Right?
So, anak nangis tak nak masuk.
And the
Itu
last,
kita kan nak.
saya nangis tak nak masuk.
Tak nak masuk, betul.
But kena tarik masuk most of the time.
So what's the fourth thing?
The fourth one I think is the most important, which is communication with your partner, which is key. Sekiranya anda bergaduh tentang duit yang dibelanja untuk terapi, that is a huge red flag. Cubalah listen to each other lah. There's a reason, and the fighting akan membawa kesan negatif kepada anak anda. If you're fighting about the therapy, mahal macam mana
whether it's
pun,
whether it's the money or not or whatever,
exactly, it's going the emotion itself within the household. Any therapy will not work if the child is not at ease. So tenangkan rumah anda terlebih dahulu. Jangan belanja semua duit.
No, and also that it sounds like there's a lot of petua to that rational choice, right?
Yeah.
But that's why I think I still want to tekankan that just pause, give it a bit of time.
Yeah.
You know, that's a rational way to do it. Don't rush and pick and again connected to the timelines lah, the so-called typical timelines. I need to decide this because it's like, otherwise how does that kid masuk tahun 1 balik? No, it's okay. It's okay to pause, your own timing, your own family priorities, so many things. So what, all the things that matter to you lah. I mean, you know, so that's why just don't rush it lah.
For me, therapy is different from treatment. So the minute you have that in mind, you will be able to make rational and wise decisions, because ada yang ibu bapa yang saya jumpa, saya tak boleh miss therapy. Kalau therapy tu anak sakit ke, saya sakit ke, kena juga pergi. Now, that does not work. That is sometimes your body or the environment yang memaksa the pause. And when you take that one session that you miss, and because you're a little bit more relaxed, that may give you time with your child, which may show you something
that's
that
fine.
you didn't see.
Yeah, it's not like a protocol like you said lah. Kalau treatment, it's like, you know, secara khusus pada timing ni, pada ni.
Makan ubat kena pada masa ini 3 kali sehari. Ataupun
anak kita tidak berpenyakit kan. Ini adalah keadaan dia.
Ini adalah terapi untuk menolong dia, memberikan dia skill yang lebih daripada apa yang dia ada. Dan bila kita buat benda itu, kita kena buat dengan secara yang tenang dan tidak memaksa apabila alam sekitar kita tidak memberi kami peluang untuk berbuat demikian. So that's the way. It's okay.
Yeah.
Okay. So as much as we sound so positive in saying this, I understand when you're just starting out, it's very difficult.
Yeah.
Tapi-
we only saying that now, like whatever, 10 years after the
later.
fact. Itu dalam dia. So,
Dulu kita kancang juga kan.
Yeah, betul.
Sometimes still lah, ada lah.
Ada.
That's why we have each other to remind.
Yes.
Calm
So like we
down.
said today, you encounter small roadblocks, but we pause and celebrate little wins, and then we move forward.
Mhm.
Okay. So with that, any last words from any of you?
I think we went
All
on
good.
pretty long today, so thank you, bye-bye. See you
Yeah,
next time.
No, sorry. Belum ada pesanan
Oh,
daripada
sorry.
penaja.
Okay, please go ahead.
Okay.
Pesanan daripada penaja adalah kami berada di semua platform social media, TikTok, Instagram, Facebook, dan episod
Itu
kami
penaja.
disiarkan di YouTube dan juga di Spotify. Sila like, share, subscribe. Jika ada soalan-soalan seperti yang kami bincangkan pada hari ini, tolong kemukakan soalan itu. You will be answered, you will be heard. Tapi kita tak boleh promise lah hari ni soalan datang tu, minggu depan kita jawab. Tak.
No,
Tapi
there's one more question from Podfest. Please wait because we're going to have an expert answer that one. So kita tak jawab sekarang. Okay, tunggu.
Ya, tunggu. So kita akan kumpulkan tetapi we don't forget. Itu adalah pesanan kami. So please like, share, subscribe. Follow. And share it with your friends. Kita Family Podcast signing off episode 76. Bye.
Bye.
Bye. Thank you.